If you were to fast forward and look at the impact of COVID over the next 3 to 6 months, I would say that we are at the point where the humanitarian crisis is really kicking in, and it doesn't look good. It's actually going to get a lot worse.
The COVID crisis has ground economies to a halt, disrupted supply pipelines, stopped vaccination campaigns.
We have a health crisis, primarily COVID, but there are other health crises unfolding. We have an economic crisis, and we have a governance crisis, including conflicts.
The learning losses that we are witnessing because of COVID-19 have been devastating for children all around the world, and many won't even return to school.
Farmers have limited areas to sell, but also they are selling their crops at a loss.
COVID is actually sort of like a magnifying glass, if you like, of the world's inequalities, exposing a lot of those underlying issues more than we've had so far.
What we're really worried about here at Concern is the effect this can have on malnutrition and hunger. This could have consequences that are much longer lasting and perhaps even worse than the virus itself.
Every study you see on the impacts, the long-term impacts of malnutrition on livelihoods and on intergenerational equity always start with some kind of shock. And here we have the mother of all shocks.
If we don't continue investing in these areas or expanding our level of support, we are likely to see an increase in the numbers of people that are chronically food insecure, a deepening in the levels of hunger in this region.
There's a huge risk and danger that the developmental gains that have been obtained in the past years would be lost during this time, because households would be fighting economic hardships that they'll be getting through selling household assets.
There's the international element, which is the collapse in commodity exports, the collapse in employment related to that, related in the African case also to travel and tourism, the collapse in remittances, the collapse in tax revenues.
People have been suffering from loss of income and livelihoods and loss of jobs at different sectors at different levels. The health system of Bangladesh, which was already very fragile previous to COVID, this health system is now facing significant strain.
As resources are coming under pressure at home, there's a real risk that major donors will want to pull back from the international response. That's not a good idea. Due to the global nature of the COVID-19 pandemic, nobody's safe until everybody's safe.
I think keeping that focus amidst all this is important, that we don't go back or we don't erode the gains that have been made thus far.
Greater resources and investment from donors, from international aid agencies are required for local organizations so that they can build local capacity. Those are the organizations and the actors that are there for the next emergency and the next emergency.
We provide food, nutrition, health services to millions of people around the world. And if these programs stop or are halted or are slowed down as a result of COVID, there's going to be dire consequences. So we're really worried about that, and we're really trying to keep our foot on the gas in terms of our ongoing programming.
The good news is there are trained aid workers on the ground, responding, staying, delivering. They know what to do. They simply need to be supported.